Greetings from Georgia in the United States.
Hi, everyone. My name is Danny Richell, and I'm the Association Manager for iHEA's activities. I know it is 9 a.m., so we can begin starting. James, are you available?
Yes.
Yeah,
I'm here.
and I know we're waiting for a few more people. I just want to make sure that all of our speakers are here as well. I think we're still waiting for.
Yeah, I think we have a minute or two.
Yeah, not a problem. We can
start on that side of the ocean, so we have time within the 90 minutes to catch up. So.
Yeah, not a problem. So if you'd like to begin, we can begin now, or we can wait a little longer.
Just give it one more minute.
Yeah.
I see we have quite a few participants, but I know there are more who had signed up on your list. So just give it another minute.
Yeah, not a problem.
Okay, Daniel, if you're there, I think maybe we can make a start. Are we still
Absolutely.
missing one speaker?
I believe Edwin is still not here yet.
Well, I think we can make a start, and then I'm sure Jacqueline won't mind going first if Edwin is a little delayed.
Not a problem. Sorry, excuse me. So on behalf of iHEA and the Early Career Researchers Group, I'd like to thank everybody for registering to attend today's webinar, Shaping Your Career Path as an Early Career Health Economist. Today's webinar will run for approximately 90 minutes and will be recorded and uploaded onto our website and the iHEA YouTube channel afterwards. Before we begin, I just wanted to run through a couple of housekeeping items. If you experienced any technical issues during today's webinar, please write them in the chat box at the bottom of your screen, and I'll be happy to assist. Everyone on the line has been muted except for our speakers in an effort to eliminate background noise. If you find yourself unmuted, please go ahead and mute yourself now. If you have any questions throughout the webinar, please use the chat box as well. And I will now pass it over to James Buchanan to introduce today's speakers. James.
Okay, thank you very much, Daniel. Hi, everybody. Welcome to this webinar. I'm James Buchanan. I'm one of the 5 conveners of the Early Career Researcher Special Interest Group, and I'm going to moderate for the next 90 minutes. So welcome again to the seminar. This is titled Shaping Your Career Path as an Early Career Health Economist. And the aim of this webinar is to give everybody here an opportunity to hear about a day in the life of health economists with some very different career pathways as you are thinking about your career pathway right at the start. We've got 4 great speakers lined up. I'm going to introduce them properly before they speak, but briefly we have Edwin Barassa, Jacqueline Levy, Ola Griffith, and Susan Spark. I will introduce them properly shortly. So briefly, the format of this webinar is that each speaker is going to talk for about 10 minutes. We will have time for 1 or 2 questions specific to each speaker after they've finished talking. Please add your questions to the chat box and I will read them out afterwards. That should take us most of the first hour, and for the last half an hour, we're going to open the conversation up for a panel discussion. Again, if you have any questions, please add these to the chat box throughout, and I will be moderating that, and we'll deal with all the questions as they arise. And the plan is to finish promptly at 3:30, which is UK time, 10:30 Daniel time, and 90 minutes from now, wherever you are, basically. Hopefully that's all clear. And if so, we'll make a start. So our first speaker today is going to be Edwin. Edwin, if you could share your presentation, and I will introduce you while you do that. So Edwin is the director of the Kenya Wellcome Trust Research Program in Kenya. He also heads the program's Health Economics Unit, who provides health financing advisory support to a variety of stakeholders and organisations, and that includes the World Bank and also the WHO. Okay, if you're ready, Edwin, over to you. I think you're muted, Edwin.
Okay, great. I hope I can be heard now. Thanks, James. I'm going to jump right in and try and make it 10 minutes. So as James said, my name is Edwin Barassa. I'm based in Kenya, and the career track that I have taken is an academic track. So all the discussions are going to, as you think through the presentation, you need to have that in mind. So with regard to how I've gotten to where I am now, I started out as a pharmacist, so trained as a pharmacist. I graduated in 2005, worked as a hospital pharmacist for about 2 years, both in the public and private sectors in Kenya. And then at that point, I felt that I wasn't happy working in a hospital pharmacy dispensing medicines, and so decided to try out something different. And essentially, I'd heard about health economics, and I thought health economics sounds like the kind of discipline that marries my interest in healthcare and my interest in economics and finance and accounting and so on. And so I left the pharmacy profession at a point where most people didn't quite understand what health economics is and why I would leave an established profession to get into uncharted waters. So I joined the Cambridge Wellcome Trust research program, where I worked for about 2 years as an assistant research officer in the health economics, or rather carrying out health economics research. And over that period of time, I applied for and got a Wellcome Trust Master's Fellowship, which allowed me or facilitated my study of a master's degree in health economics at the University of Cape Town. And then after that, I immediately proceeded to do a PhD in the same university. This is the University of Cape Town. I got a master's degree, or rather a PhD degree in health economics, funded again by the Wellcome Trust. Now, when I finished my PhD, I applied for a fellowship. So this is the equivalent of an early career postdoc grant that allows you to work under a mentor and develop your career. So it's known as a Wellcome Trust Training Fellowship. I applied for that in 2015 and got it, and worked as a training fellow for about 2 years. And over that period of time, I established and began my headship as the head of the Health Economics Research Unit within the Cambridge Wellcome Trust Research Program. And this is essentially a research group within the program that carries out a whole range of health economics work. Currently, there's about 15 of us doing a broad range of health economics work. At the end of 2017, I applied for and was appointed as the director of the Nairobi program of the Cambridge Wellcome Trust. So this is a program that has about 100 scientists doing work ranging from clinical epidemiology to population health to health systems. And this is my current role. And last year I was appointed as a visiting professor of health economics at the University of Oxford. So this is my journey to where I have been now. And really my reflection is what is up there, which is an extract from a poem by Robert Frost. It's really about thinking about what path to take and daring to take a path that is least traveled at the time in this country. How does my typical day at work look like? It's mostly a delicate and difficult balancing act between doing my research work, so typical stuff around research, so reading, analyzing, writing. I don't do much data collection anymore, but I work with people that do that, doing administrative work because I have leadership and administrative responsibilities, working with students and staff of my research within my research group, and engaging with policymakers to try and get them to have access to the evidence that you generate. There's also a lot of responding to emails, wrestling with Reviewer 2 that you're all aware of, doing some tweeting, and of course, spending time on Zoom, like what I'm doing right now. The favorite part of my work is really working with students, working with young researchers and scientists that are interested in developing a career in health economics. My research work continues to be the best part of my day, and engaging on Twitter is also something that I do not mind in the course of the day. So I thought a lot about what to reflect on in terms of what have I learned over the period of time that could help an early career scientist who's interested in growing in whatever field you are. And really, other than the generic advice around, you should work hard and so on and so forth, what I have found quite useful to me over the past couple of years is working with people that are way more advanced in their careers than myself, and working with them as my mentors, as collaborators, and leveraging on their expertise and knowledge and skills and advice to essentially propel my own careers. This draws this quote by Isaac Newton that if you really want, if you want to see far, you need to stand on the shoulders of giants. And whenever I reflect about my career, I keep crediting any progress that I have made or any advances that I have made to the people that have worked with me that are really giants in the profession. So just to cite an example, there is a bibliographic analysis that came out last year looking at authors that have published, leading authors that have published in universal health coverage globally. And there's a list of 20 of them. And I looked at them and realized that I have worked with about 7 out of the 20 of them. I've worked and continue to work with about 7 of the 20 of them. And there are many others who are not focused on universal health coverage that are giants in their careers that I work with. And really, I see this as a key ingredient to the advancement of the career of an early career, an early career profession or an early career scientist. But then for one to be able, the other reflection, and this is the second and last reflection, is that for one to be able to work with these individuals that are quite senior, quite successful in their career, these are also individuals that are quite busy and do not have time for, they don't have time for nonsense. And so to be able to work with them, you have to seek out opportunities to work with them. And part of it is ensuring that you're the kind of person that they would want to work with. And with this, I reflect on the quote by, the famous Nigerian author, Chinua Achebe, who essentially said that if a child washes his hands, he could eat with kings. And so the idea really here is that, for you to be able to work with people who are clearly, much older, more senior, more accomplished than you, you need to be well prepared. You need to do your part. You need to carry your weight, and you need to, position yourself in a way that makes them want to work with. And part of that is just about you doing your part. And some of that for me has been to always be very clear at any one point about where is it that I want my career to go? What is my career goal at any one time? And here I have to clarify that my experience, again, over the past couple of years is that you don't always end up where you thought you will end up, but that doesn't mean that you shouldn't make plans. So at any one time, I've always tried to have a plan, and I've always appreciated that my plan might be clouded by my ignorance. And so talking to mentors, talking to people who are advanced in their career to give you ideas about what options and possibilities are out there is important in shaping your career goal and your career pathway. And then once you figure that out, mapping out that pathway, what road will it take for you to get there? And then breaking that down into activities that I then prioritize in the course of the week and in the course of the day. And I say this because, for instance, I currently have an administrative, I've held an administrative role for the past 4 years now. It's going to about 4 years now, but it's always been very clear to me that my track is academic and research. And so I've always tried to carve out time within my day to continue to do my research work rather than, being consumed by the administrative work. And then finding ways to go around barriers. And here I say this because there will always be barriers, there'll always be barriers around. So for you to advance in your career, for instance, an academic career, you need to have supervised students, but if you tried to get the opportunity to supervise students, you're going to be told that, student supervision needs prior experience of student supervision, which is a bit ridiculous because you have to start, there has to be a starting point. So trying to find ways around such barriers is quite important by, for instance, again, leaning on your, on your giants and leaning on your more senior colleagues to work under them and to get experience through working under them is one of the things that I found to be quite useful. Thank you very much.
Excellent. Thank you very much, Edwin. That was fantastic. So many good, important points there for early career researchers to bear in mind. There are no questions at present, so we might move on forward and see what questions come up for other speakers and for everyone generally as we go through the presentations. So Jacqueline has already started sharing. Everyone, please do add questions to the chat box as they come to your mind, whether it's for specific speakers or for general discussion at the end, and we will pick these up. Okay, so our second speaker is going to be Jacqueline Booley. Jacqueline is a Senior Scientific Advisor at NICE, the National Institute for Health and Care Excellence in England. Obviously, Jacqueline has a great deal of expertise related to economic evaluation, and she's also worked for the European Medicine Agency and has studied and worked at Erasmus University and Utrecht University. I'm sure Jacqueline will fill in the details around that sort of skeleton of her career in her presentation. So Jacqueline, over to you.
Thanks, James, and thanks to iHEA for hosting this webinar. So as you might have seen from my first slide, I actually, in the time period between being asked to speak at this webinar and it happening today, I actually took up a new role within NICE. So since last month, I'm the technical director for NICE Scientific Advice. So NICE Scientific Advice advises companies that includes pharmaceutical companies, but also medtech developers who are anticipating a nice submission or want to launch their products in the NHS, and we advise them on their kind of the evidence requirements and their development plans. It's a team that sits within NICE's Centre for Health Technology Evaluation, and I'm based in London in the UK, but NICE has offices both in London as well as Manchester. So as James said, I started out, so I'm from the Netherlands originally, and I did a master's followed by a PhD in Rotterdam at Erasmus University. So I did the master's in health economics there, and then I did a PhD, which was a collaboration between Utrecht University and Erasmus University in Rotterdam. So I had supervisors at both universities, which sounds like a recipe for disaster, but actually it worked quite well in my case, so I feel quite lucky. So what my dissertation was looking at the use of methods from health economics, so mainly cost effectiveness analysis, but also discrete choice experiments and continued evaluation methods, and applying them to the drug regulatory framework. So what I ended up doing is looking at doing a cost effectiveness analysis of mainly drug safety regulations. That I did that for 4 years and concluded that you can do it, but it's complicated. So that's the academic work I did in the Netherlands. After that, I did 2 postdocs. So first I did a postdoc in Rotterdam, then another one at my previous department at Utrecht University. But in 2015, I was asked to go on secondment at the European Medicines Agency that was still based in London. Ironically, they've now moved to the Netherlands, and I'm still here. So because I'd done a lot of work on the kind of the regulatory framework for drugs, focusing very much on the European framework, they asked me to come work on some projects that I was involved in there. So that was looking at their registries initiative, amongst some other stuff that I did there. And then I joined NICE in 2015, and that felt like a bit of a more natural place to be as a health economist than the European Medicines Agency, although it was a really great learning opportunity to spend some time at the EMA. So I've been at NICE for more than 5 years now. So I started as a scientific advisor in NICE's Science Policy and Research Program. I worked on a international European funded research project that looked at adaptive pathways. So this idea of kind of early engagement and early and progressive patient access to promising innovative medicines. And then I moved on to a more senior role within the same team and within NICE. And as I mentioned previously, very recently took up the role of technical director for the NICE scientific advice team. So a typical day in my current role is quite likely to, I mean, it varies, of course, but it's likely to involve at least some of the following. So one of the things that I do is that I chair scientific advice meetings, and I review and sign off the reports that we produce and work with the team on developing and writing these reports. On a typical day, it's quite likely that I'll have a couple of meetings. So that will be either with people in my team or people from other NICE teams that we're working with. But it also involves quite a lot of meetings with kind of external stakeholders. So that can be regulators, can be other people who work in other HTA bodies, but also industry organizations or people who work in the field. Two more technical pieces of work that I'm involved in involve a project that NICE is running with the Department of Health and Social Care and NHS England, where we're looking at developing new evaluation and payment models for antimicrobials. And also NICE is currently in the process of reviewing its methods, and that's also an activity that I've been involved in. Under normal circumstances, I would also be attending conferences and giving talks, although I'm still attending conferences. They're all virtual now. But that is something that is a bit different in the current state of the world. So reflecting a bit, obviously, other than at Win, I've left, I've spent some time in academia, but left it and now work for public organizations. So I wanted to reflect a bit on some of the differences between academia versus working for NICE. And I think a key difference is that, you know, as an academic, you're really working on your research, and you're also almost building this, you know, your own personal brand of you, the researcher. You know, you publish everything in your own name. You're trying to build, you know, establish yourself as an expert on a certain topic. And although a lot of the work within NICE, and definitely the kind of work that I do, still requires a lot of technical knowledge and skills, there is a difference and a bit of a shift in, you know, this focus much more on the work you do as an individual versus working for a public organization. So NICE is an arm's length body, which means that we do have the Department of Health is kind of our sponsor, but we make recommendations that are independent of government, but we're still part of kind of the public system. So that means that in terms of the academic freedom that you have to explore different things and ideas, there is a difference there. But that also comes with advantages, because it does mean that a lot of the work that you do has, you know, real life impact. And you can really, you know, achieve things. And sometimes the projects that you work on mean, you know, especially when you're working for NICE, means that people will get access to certain treatments, or, you know, that you're helping in that kind of process. And I find that quite rewarding, and it's something that's you know, a really nice aspect of working for a public organization such as NICE. And then I've tried to reflect a bit on survival tips for, you know, early career researchers. And I've tried to think a bit about, you know, what is when I was preparing for this, like, what is the stuff that would have helped me if if someone would have taught me these things when I was just starting out. And I think one of the things that probably wouldn't have listened to any of it, but still, I think that one of the things that you see a lot is that, you know, academia can be really competitive environment, and you see all of these people that are quite similar to you or in a similar stage in their careers. But even though, you know, you will see some people that are, you know, having successes or publishing, you know, papers in high impact journals, or, you know, getting certain grants, it still is, you know, be really selective in who you actually are comparing yourself to, and not do that too much, because even if you see other people doing well, that doesn't really mean that you know, has anything to do with the value of you or the work that you're doing. And everyone really is, I think, on their own path. So it can be easy also, you know, to get a bit bogged down by that when you see other people doing really well, especially knowing how competitive academia can be. So, you know, don't compare yourself too much to others, and especially what they're doing. And then something that I've really found out kind of going along the way is, especially when you start out in a field, you know, it can be quite daunting when you started to speak and present on your research and speak on a given topic, especially when you know that there are lots of people in the room as well who know a lot about your topic. But if there's anything I've learned in the last couple of years, is that expertise really is relative. And especially when you know a bit more about a certain topic, to people who know less about that topic than you, it really won't be obvious, you know, what the extent of your knowledge is. So don't feel like you are not capable of speaking on a certain topic and having expertise on a certain topic until you know everything there is to know about it. This is something that you kind of build over time. And don't be afraid to, you know, see yourself as an expert and speak about things with confidence, just because, you know, you don't have a 30-year career researching a certain subject. And then I think the final thing, and this, I should have put this on the top because this might be the most important one, is that we spend all of this time, you know, like going to school and studying and gathering knowledge and really working on our technical skills. And then, especially when you leave academia, but I think that this is relevant within academia as well, you know, you're put in the complex social environment of an organization where you have a team and a boss and colleagues, and you need to work with people constantly. And, you know, that can be really challenging at times. And, you know, we don't always give people a lot of skills in, you know, how you deal with those types of situations. But, you know, being able to work constructively with others, I think is sometimes a really undervalued skill to have. And there are resources for doing, you know, like spending some time in investing in developing these types of skills. And that includes, you know, there are courses that you can take, you know, sometimes organizations offer coaching sessions, that type of thing. I'm sure that there are good books on the matter. But also just by observing how others, you know, work successfully, and potentially also by observing what people do who don't work successfully with others. You can learn a lot from that, I think, as well. But especially if you are in situations where, you know, you have to work with someone, where you're struggling to work with a person, or if you have a difficult relationship with someone, that can be stuff that can really impact you, and your life. So that is something that is, I think, worth investing some time in. And then finally, I thought about, you know, tips for building your network. And I was thinking about, you know, what has helped me build a network. And I think the first thing is that whenever you get invited to stuff or people will ask you to come along to things, you need to say yes a lot. So attend conferences and seminars and workshops and meetings, not just within your own organization, but if you know people who work in other organizations and they invite you to stuff, you know, that's where you tend to meet people a lot. Sometimes these things have free drinks receptions, which obviously is a nice bonus, although again, within a pandemic, you know, that doesn't seem to translate well onto Zoom. But still, you know, take all the opportunities you can get to attend these types of meetings. And then I also wouldn't discount the value of having a network of peers. So when I look at my network now, you know, quite a significant proportion of that is also just because, you know, I've been around for a while, and there are people that I did my PhD with, were in the same PhD program around the same time, who now are in more senior positions that also work in the field. So this is also something that you just kind of happens organically to a certain extent. So I wouldn't worry about it too much, you know, especially when you're first starting out. But do take those opportunities that present themselves, you know, to build your network. And then finally, I think Edwin already, you know, alluded to this. There's quite an active health economics Twitter community, which seems to be a bit more academically focused. But then LinkedIn is also a good place to, you know, if you've spoken to someone at a conference or had a chat with someone at a seminar, you know, add them on LinkedIn or follow them on Twitter. That's also a good way to build your network. And then finally, this is my last slide. If you are thinking about leaving academia and are interested in working for NICE, we pretty much are always recruiting for technical roles. We have about a dozen that we're recruiting for at this time. So I've included the link where all of NICE's vacancies are being advertised, with offices in Manchester and London. but being home-based at night is also an option. I think I'll leave it there. Thanks very much, and do get in touch if you want to know more about working for NICE.
Great, thank you very much, Jacqueline. That was excellent. Again, a lot of really important points, particularly on the people skills. I think it's something we can probably all improve on. I'm going to move on to the next presentation. I can see there's a couple of questions in the chat from Florence, and I think they're probably questions we can bring up in the panel discussion. So Florence, I'm not ignoring you, but I think we can deal with those questions later on. Without further ado, I'm going to introduce the next speaker. So our third speaker is going to be Ola Griffith, again, who's already a step ahead of me in the presentation up. Ola currently works at UNICEF in New York, where she leads work on immunization financing. She also works at London School of Hygiene, spent time in the WHO, has worked for a little bit of time in health economics consultancy, and was an ODI fellow earlier in her career as well. So again, I'm sure Ola will fill in some blanks there. Over to you, Ola.
Thank you very much, James. Yes, let me take you through this. Thanks everyone for joining. So I'm just going to give chronological order of my jobs, a few highlights, and then some specific advice. So I first of all want to acknowledge that I feel, first of all, really privileged to be working in health economics. I think it's exciting, such a great career. And also really acknowledge that I feel, I think it was Edwin who said, you need to have a plan. I have not had a plan. It's all been luck and coincidences. And yeah, the clubs really show where I feel I had extra luck. So my first job was an ODI fellowship. And I think those of us who managed to get this fellowship, I mean, it's such a good start. And I put a map of Guyana there. It's in South America because perhaps not everybody know where it is. So I was posted in the Ministry of Health of Guyana. So I was only just a normal economist. So it wasn't my choice to start to work in health economics, but that's because they posted me there. And so that was just by chance. So double luck. Then I came back to Denmark and I worked for a consultancy agency. And then another privilege, you know, I'm sure you've heard about junior professional officers. So that's, again, you can compare it to the ODI fellowship scheme. You know, I really acknowledge today how important it is that these schemes continue. So if I become rich one day, I will donate because it's just such a good start for young people to get in. So I got this JPO via Danita and was posted in WHO in Geneva. And there I think I had a second stroke of luck because it was in the immunization department. So again, I didn't choose it. They just posted me there. And I really worked in immunization since. Then I was at London School of Hygiene, tropical medicine for 10 years. And now I work at UNICEF. And I'll talk about the consulting. You can see I have a little bit of consulting as well, and I'll just talk a little bit about that as well later on. So first of all, my biggest learning experiences when I was reflecting. So I was just really reflecting, like what are sort of when I think back, you know, I'm old now, I'm 51, right? So I was just thinking back, where have I really learned something? And I feel, of course, Guyana. When I say, what do I do? This is because I turned up, my boss was away, he was on holiday, there was an empty office, and this was before the internet. I brought my own computer, but there wasn't even a piece of paper in the office, right? So I just had to do something. Of course, that was a huge learning experience. Then I really think the hospital, just being forced to actually work, we're health economists, we're not meant to sit in offices all the time. You need to understand where health is being provided. So I was really a lot in the hospital, in the wards, you know, I really think, I can't say that enough, you really have to go out and be in the health facilities and work with the staff that are providing healthcare. In WHO, it was really the wealth of expertise. I was young, it was just listening to all the people in these big expert meetings they have. I learned tons about that, and then about how the organization works. When I came to London School of Hygiene, it was really, then I was an academic, and I did do my PhD while I was there. So that was really just research. And then I really want to say again, the consultancy assignments I've had, I really feel I've learned, it's, you know, when you're a consultant, you press a lot of work in a very short time. That's the fact of it, you know, you need to do this in 2 months, and you need to provide. And you know, I've just learned so much from doing those, because you're just being forced to deliver. And many of the consultancies I've done have evaluated aid programs. So that's really how I learned how aid works. Then also I've been part of both the Gavi Independent Review Committee and the NICE. At that time, it was still Clinical Excellence. I think you changed your name, Jacqueline. I looked it up yesterday. I'm like, no, I don't know that name. Anyway, so these committees where we are part of a process, you know, I'm the health economist, but it's a multi-disciplinary, of course. And that was a huge learning experience. And now at UNICEF, it's really, I'm trying to learn management. Okay, so immunization, I'm putting that glove off again because I'm just lucky to work in immunization, I feel. I mean, and I've also worked in other health, so eye health, obesity, allergy, but really 19 years in immunization. And what's great about it is, you know, it's one intervention, but it's, you know, it's measles, it's diphtheria, it's hepatitis B. Like, you need to know about all the different diseases. It's infectious disease, which is particularly interesting. Child health, everybody loves kids. And that's really also why funding is really a problem for us. Donors love children. They love something they can count, and everybody can count how many kids they reach with vaccines. So we are quite privileged that funding hasn't been a problem in the time I've worked in this field. I can't talk to you about saying that this is, you know, this is why it's exciting to be working in vaccines right now. I mean, who would have thought, you know, the whole media writes about what we are working on right now every day. I don't even read it anymore because it's just too much. And vaccines are really in the spotlight right now. So yeah, we're busy. Some specific advice. So first is, really don't focus on only being an economist. Don't think, oh, I'm the economist, I should only look at the numbers and financial numbers, because, you know, you're a health economist. And I mean, one of the biggest learning, it was really, you need to know epidemiology. Of course, if you do economic evaluation, you really have to know the disease. And I think epi is really important. And disease-specific expertise as well. If you do an economic evaluation of, obesity, you need to know about obesity, right? And also, I think this is a bit what Jacqueline also said. Don't be afraid to have an opinion outside your area of expertise. It's a good way to gain respect. And often, as was already said, you know more than you think. And then I've already said, I think consultancy experience is actually really valuable. So if you are in between jobs, I can really recommend to just be a consultant. It's hard work, you're being forced to provide value, and it also gives you insight into the private sector, which can be, I found it valuable. As I already said, try to work within some health facilities. And then I want to say, you know, a PhD is good to have. Of course, if you want your career to be in academia, you got to have it. But I don't think it's indispensable. And I think sometimes it's mainly for ourselves. We think it's expected, but I don't think it always is. Only in academia, really. So don't think you can't do anything without PhD. Networking, try to figure out who's doing what. That's likely to come in handy. Just keep your eyes out who's doing what. And then I feel my little niche is immunization. And I find it useful because it keeps you on track, and jobs are often easier to find if you have a little niche in just something, a niche area. I think that was it. Thank you.
Thank you very much, Ola. There's a few points there that I suspect we will come back to in the panel discussion, in particular what you said about the need or not to have a PhD, and maybe we can circle back to that point later on. I'd be interested to hear other views on that one. Okay, so without further ado, we'll go to our final speaker, who is Susan. So Susan Sparks. Susan is a health economist on the health financing team at WHO in Geneva. She also works at the World Bank, for USAID, and studied at least 3 universities I can see on her CV. So over to you, Susan.
Okay. Thank you, everyone, and thanks for having me join this panel. I think it's always an interesting moment. I think it's perhaps because I turned 40 on Friday that it's like, oh, I'm not the early career person anymore. So it's both good and bad. But I'm also have the privilege of speaking after a great group of colleagues. And so I feel very fortunate to be here and to have this opportunity to reflect as well. So I'm on the health financing team in WHO Geneva in the Department of Health Systems Governance and Financing. We are the economists within WHO. And it's not to say that there aren't other economists that are scattered around WHO, but the team on health financing, we primarily all come from, I think we would label ourselves as economists or health economists. Okay, let's see. Okay. So this is a quick graphic I tried to put together to put together the different pieces of my journey. So I started off as an undergrad, really discovering this world of international political economy at the School of Foreign Service. And so I really started quite young in terms of this field of international development, international economics, and then ended up after getting a master's in development economics, really fell into the health sector. And so again, this is keeping your options open. And so when I interviewed for a JPA position, a junior professional associate position at the World Bank, I said to them at the beginning, I said, I know nothing about health. I want to be clear about that. And they said, no, it's okay. We need people who have an understanding of fiscal policy. And so, and that really opened my eyes to, okay, this is analysis of something concrete. The objective is concrete. And I really enjoyed that. And so then I said, okay, if I'm really going to pursue this career, I am going to go for the PhD. And I have to say that I had a boss at the World Bank who on the very first day of my job said, okay, this is a 2-year position. Where do you want to be in 2 years and how do we help you get there? And so I think that that's an incredibly important factor, both for people who are starting out to look for those people who will help you on that journey, but also for those of us now who are hiring people that thinking about what comes next. And so I had a brief stopover in Berkeley. And after feeling as though I had dropped off the face of the earth in California, really found my kind of intellectual home in the Department of Global Health at Harvard at the School of Public Health. And then ended up at WHO. And so I also have here different places that I've worked, either interned or consulted. And I think this goes to similar to what Ola was saying, that any of these experiences just add so much to your wealth of knowledge and any activity that I do actually. And I pull from each of them actually quite regularly. And so any opportunities, I also consider myself a student of institutions. And so being within these institutions is really fascinating, understanding the governance arrangements, the financing, the financial incentives. And so you can see that I'm far more, I'm research oriented. I have this practitioner's side of me. I also have added at the bottom, and I think that this is important in terms of, for me, in plotting my own career. So I got married after my master's degree. I had my first child in my second year of my PhD, and I had my second child in my fourth year of my PhD, and then I finished in 5 years. So, but they no doubt that family dynamic is an important part of my career, and I know my husband would say the same thing. And so they set a lot of the parameters in terms of the choice set that I've pursued as well. So now life as an economist at WHO, I think it's really interesting because after having been at the World Bank, which is filled with economists, to come to an organization where you are really a few amongst many doctors and health-oriented people. And so it's an interesting dynamic to be in that space. It's both a luxury and a curse in that oftentimes you are the only economist in the room. But also oftentimes you find that maybe what you're saying isn't being completely internalized. And so you have to have that translation in terms of how we might talk to one another as economists and then how we talk to the rest of the world. And so I feel as though my day-to-day involves a lot of juggling. And so there's a lot of competing demands, a lot of kind of 1 minute there'll be a grant request that I have to fill out or comment on, or there's a budget that I need to prepare, or there's a country demand, there's been some sort of terms of reference, there's requests for talking points. In between, while I'm really trying to focus a lot on my own research and my own programs of work and my own country support activities. And so that ability to be flexible, just even in the day by day, hour by hour, is really important. But also making sure that you protect that time for research and what are those really important technical products that you need to focus on. And it can be a challenge sometimes. I also spend a lot of time coordinating, and the coordination function. So I sit in Geneva, but many of my health financing colleagues, even within WHO or in the regions or in the country offices, I coordinate a lot with countries and ministries of health that we're providing support to, with partners, so with Ola and with the Global Fund and Gavi and the World Bank, especially when it comes to financing. Of course, our main counterparts at WHO are ministries of health, but of course, it's really important to interface with the ministries of finance as well, and in that translation process. And so it involves those soft skills that I think that Jacqueline referenced are very important in our work. And so there is also a decent amount of administrative tasks. And I think I learned that quite young, being a project manager for USAID, for a USAID contractor, understanding that this involves hiring people, any work involves hiring people, involves contracts, involves terms of reference, and involves budgets, and being comfortable in that space. I also do a decent amount of publishing, so both within WHO documents, but I do try to keep that focus in terms of academic publishing as well. And we also have teaching opportunities. And so we do a lot of capacity building, and I really enjoy that. And I think that those are important in terms of keeping different skill sets sharp. I used to travel, and this was part of my choice set. And coming out of my PhD, I did not pursue the World Bank, for instance, because my missions at WHO primarily are, I only would have, before COVID, only one or two, or one a year that were more than a week. And so that, whereas at the World Bank, you can have 2-3-week missions. And also that the schedule is a bit more on my terms. And then we also spend a lot of times in conferences and these sorts of things. But that was important from a balancing perspective as well. So the good, the bad, and I won't say what, but we know it's the ugly. But I think these will translate into some of the tips that I have, which, so the good at WHO is that I have a fantastic boss, and I also have had fantastic bosses throughout my career. And that has really made all the difference in terms of, and mentors within my academic programs as well. And so finding those people that are, I think the team is important, but I do think the boss and who you work for is really important. So I get to do policy-informed research and research-informed policy. And I think that that's a real luxury. And so we at WHO, we provide technical support. We don't give money, at least in my space. And so the research that I conduct is really informed by what the demand is coming from countries. And then the policies are really based on, okay, what is the best practice? What's happening in different regions? What's happening in different countries? What is the data telling us? And so I really enjoy that. And I also enjoy, it's great to be the only economist in a, or not the only, but some of the only economists in the health organization, because it really creates this learning environment. So even though I have a PhD from a School of Public Health, I learn a lot about, was just working on a neglected tropical disease sustainability framework. And, it's a learning experience as well. And there is this constant feedback loop between country demand and work priorities and how you adapt to those priorities. And so I think that you don't necessarily get to set your own research agenda in that respect. The not so good is the bureaucracy is real, it is heavy, it is difficult, it is frustrating. And that's part of the job. I think that if you have a good boss, you can be protected from a lot of it. But I think that, it is real. I mean, trying to coordinate and do country work from Geneva, we have to go through regions, we have to go through countries, we have to get the request from ministries of health, and then it has to come back up. But the good thing is that once you get that, you have direct access and you're working directly with country policymakers. There's often too many competing demands. Our time is not accounted for. And so we have our objectives, but competing demands, requests can come in and they just get added. And so there can be that pull of feeling like that you're getting pulled into a lot of different directions. And so you set out even in a given day or week or month that you say, okay, I want to get this done. And then you really have to be prepared for some of those shifts. WHO's funding and administrative systems I put here because I'm talking to economists. I think the short-term earmarked funding that comes with WHO's mandate is a huge challenge in terms of how we raise money, how we conduct our work. And then even with the best of intentions, the ability to really coordinate and to work as economists with, say, for instance, the immunization department. There's intentions, but it can be a challenge at times. And I think that there's efforts to really try to change that, but it can be frustrating sometimes. So what about you? I should have a about there. So what about you? So these are some of my tips in terms of what's been really influential in setting my own career path. First is send the email. And so I tell this story because I learned this very young in my undergrad career. I had just discovered this whole world of international development my freshman year of college. And I discovered this guy, Jeff Sachs, and I sent an email to him to his Harvard address because he was still there. And he emailed me back immediately within a day and with interesting ideas. And that's when I learned, I said, oh my gosh, okay, so people really do get the emails, and they really do. They really do get the emails. And it's not to say that your response rate is going to be 100%, but all you need is that one person, that one email to hit on the right person's desk at the right time. But also when you send that email, be clear about your intentions. If you're looking for a job, attach your CV. If you're looking for a research question or data, say it. I think that that's only going to make things easier for everyone, and you'll have a better chance of a response. Even when I was finishing my PhD, my research committee said, okay, these are the people you need to email in advance. And one of the people ended up being my future boss, who ended up emailing me back in March and saying, oh, I actually have a consultancy, which then led to my fixed term staff job. And so I think that's an important lesson, that people do get those emails. I think be flexible, but also honest about your own parameters. I think it's okay to say, for me, I only applied to PhD programs in places that I knew would be convenient for, my husband and I decided those together. And similarly, when I conducted my job search, that's my own priority set, but I think it's okay to be clear about the multiple different demands that you're balancing when you're plotting your own career. I think choosing your boss and mentors carefully is absolutely critical. I think you can have the most beautiful job description in the world, but if you interview with someone and you think, oh my gosh, the person's a real jerk, I could never work with them, there's a good chance that that might be the case, and you want to do some due diligence about what that dynamic is, because work is a huge part of your life. And I think, as Jacqueline said, that it can draw out on, it can have huge externalities on everything else. And so I think being very careful about that, but also being very careful about who are the mentors that you want to bring with you along on your career journey, because they will be an invaluable source of feedback as well. For me, I try to keep as many options open for as long as possible. And so even now I'm clear to make sure that even though I'm in WHO, I have this more practitioner side to me. I am careful to keep publishing. I enjoy to continue to teach. Part of the reason I got the PhD was because I thought, okay, well, this is a huge luxury, and I agree it is primarily for ourselves, but it does keep those options open in case academia becomes an option in the future. I think leveraging your dissertation and your interests, being clear about what those are. I know when I was doing my PhD, my dissertation advisor said, be careful, your dissertation topic will be your career for 5 years after you finish. And that's absolutely the case. The title of my dissertation was The Political Economy of Health Financing Reform, and I published a special issue of a journal on the political economy of health financing reform in 2019 with WHO. So you do carry that with you. And I think this issue of focusing on content and objectives. And so while I think Twitter and LinkedIn are really important, I think by far the most important thing is being really solid in terms of your own content, your own research, because that I think will sell the most. And so while you need the Twitter sound bites, if it's not backed up by solid research and evidence, I think that people in our field can tell. And so if I were to balance that, I'd say that remains really, really important. And also what your objectives are. Are your objectives to influence policy? Is it to advance a certain research field? I think thinking through about, okay, what are the actual, not just the objectives for your own personal career, but what are you trying to influence? What are you trying to impact on? I think can be a useful way to start to frame your choice set. So that's all. And here's my email address. So please feel free to email, and happy to have the discussion. Thanks.
Great. Thank you very much, Susan. That's brilliant. Again, lots of points for discussion. I think a few of those will come up in the next half hour or so. So that's the 4 presentations. If I could ask the speakers to, well, at least put themselves up on video if they're not already there, and be ready to unmute. We're going to open up to a panel discussion now. We've had a couple of questions chat box, which we'll deal with first, but please, everybody who's in the audience, please do add questions. I've got to start the discussion off, but it would be much better if they came from you as well. So please add questions to the chat box as we go through. So I'm going to start. Florence's first question actually kind of aligned with the first question I was going to ask anyway. So as an ECR, early career researcher, or maybe a newly graduated master's student, what would you say is the best way of building a network of like-minded researchers working on a similar topic to you? And then kind of related to Florence's point in the chat, what is the best way to contact and get responses from well-respected leaders in your field? Is it as simple as just sending that email, or are there other strategies that might work as well? This isn't anyone in particular, but anybody who wants to respond, please do.
I mean, I'm happy to respond to that. I think I would kind of support what Susan said about just send that email. If there's someone you have an interest in working with, or who's an expert on a certain topic, just get in touch with them. Some people won't respond because senior people tend to be quite busy and get lots of emails and then complain about it a lot as well. But when people get in touch with me with questions about this, I think recently I got an email from someone who's doing research, and they come across a paper I published on the topic, and I don't get questions about some of that stuff that often. So I actually thought it was quite nice, to get the opportunity to think about that material again, and they asked some really good questions. So, you never know. So just, get in touch with them, and then, just attend conferences or seminars, that type of thing. Be keen to hear what other panelists have to say on it, but that would be my take on it.
Thanks, Jacqueline.
Yeah, I mean, I haven't personally, I don't think I've ever sent emails like that, but I might be from a different generation. And I think I would respond to the emails, but it's true, we're just a little too busy, so I would respond, but I'm not sure how far would go, with just emailing. But it's hard to say in these COVID days. Face-to-face is just so much more effective. So when we get out of this, proper networking can start. Yeah, that's my take.
I think maybe I can add, in addition to that, the other strategies would include volunteering, being open and, being open to volunteering to do stuff, to work on projects with people. because as Ola mentioned, I mean, sometimes people don't have time to, not everyone will have time to respond to an email and to have a meeting with you, but working together provides an opportunity for you to engage, and it's easier to get involved in a project when you initially volunteer rather than, when you're hired on a proper job. So that's probably one of the strategies, and just being in the same spaces with people. So I think someone talked about, being in conferences, being in seminars, and trying not to be in conferences and seminars just as a passive participant, but being an active participant. So actively applying, putting in abstracts and making presentations, getting noticed, and talking to people afterwards.
Okay, I'll add in mine quickly. I think my most success has come from doing a really good job on anyone. So all of my career progression, I can trace it back to, okay, even in an internship, as an undergrad for USAID, you do a really good job at that. And then the best thing that can happen actually is if then your boss then passes on your CV to somebody else that they're connected with. And that's similarly now that I'm in the position that I'm in. If some of my former professors reach out, or close colleagues, and say, hey, can you talk to so-and-so? I'm much more likely to talk to them. I'm much more likely to give that CV another look or to make time for that person. And so working through your own direct network, and that predicates, though, having made sure that you've really impressed those people who are in your proximity, whether it's in your master's program or in your job, and then making the asks, say, oh, I'm interested in such and such job. And if you know somebody in your very close circle who's connected into that space, I think it's okay to ask them, well, can you email so-and-so and, with here's my CV and that sort of thing. And I think that's also really quite effective.
Yeah, no, I think that's really good advice. I'd also add a +1 from me to sending that email. I remember being very desperate for a data set for a master's project and emailing around a bunch of development economists when I was doing my development economics masters, and I got responses. Some of them were, a little bit of a reach in terms of the emails, but I still got, a good proportion of responses. So send the email, you never know. And I would echo what Jacqueline said about, if someone emails me about my work, I will always reply to that email. You don't get many of those emails. So it's always nice to know that somebody is thought enough about your work to have good questions about it. I'm going to sort of change tack slightly, and this touches on, I forget who raised this point, but often as an early career researcher, and this again relates to a question that Florence raised, you need to work with different stakeholder groups, with different knowledge of evidence-based healthcare policy. Is there any advice you have of working through issues that arise, communication strategies, conflict management strategies, as an early career researcher who maybe doesn't have much experience, but sort of managing people with different backgrounds in that sort of scenario?
Yeah, I'll have a first go at this, because I think it was in response to the thing I said about, working with people. I would say that, and there are good courses that you can do for this type of thing as well, about, having difficult conversations and strategies for that. I think the number one thing that I've learned along the way, especially working with lots of different stakeholders with different backgrounds, sometimes on sensitive issues, is that the number one skill you can have is listening. It's not actually about being persuasive. It's about understanding, even if you don't agree with the position or you're trying to get someone on board on something, is actually listening to what they have to say. Because a lot of times when there are sensitive topics or when people disagree on something, there probably are genuine concerns about something on the other end that you may or may not be able to influence, but it helps a lot when you actually listen to what it is and respond to what the other person is or the stakeholder is trying to tell you, rather than going in thinking that, you know, the only success that you can achieve is when they see your point of view. Sometimes it's just that they are, you know, they understand your point of view, they just have a different one. So it can be much more important sometimes to just actually listen and acknowledge what is happening on the other end, rather than you know, being persuasive or having the best. Not always about having the best argument. So I would say that, especially in kind of in conflict situations, that is really, really important. But also, like, when it comes to these things, you also just learn by doing, by observing people who are good at this and who are really good at like building relationships and mentors, you know, and the more senior people that you work with. And conversely as well, you know, if there are people that you come across, I think it was Susan who mentioned, you know, if you come across to people who you don't like at all, or, you know, strongly dislike, also observe why and reflect on why that is, and try to do the opposite. You know, sometimes that's also just a great learning experience. But happy to hear what others think on that.
Thanks, Jacqueline. Okay, perhaps we'll move on to the next question. This is a question that's been sent to me. Possibly a question more for Susan and Ola, but Edwin and Jacqueline, do chip in if you can. There's a question about, do you have any insights as to balancing in-country versus global or headquarters experience? You know, if you're interested in working on health economics and financial issues in LMICs, for example, you know, how do you balance that, you know, in terms of the experience? Any insights related to that would be welcome, I think.
So just clarify, what do you mean in country? So
I think the question, my sense of what the question was after was, you know, the experience of working in country versus working perhaps, you know, in Geneva, for example, you know, that sort of balance, you know, where to place your time best, and the advantages and disadvantages of both.
Yeah, so I would say, you know, country experience is definitely a huge plus. You know, people who've had that are just better, definitely. So I think we would all value that, definitely. But of course, the work is very different. The work is very, very different. So in a way, when we do a global level, I think it's easier actually perhaps to go from country to global, from global to country, perhaps, because we become so global and it's all about meetings and organizations. And so it's two very different types of work. But I think you can definitely go from country. Of course, you can do both transitions. You just have to be aware how different it is. Yeah.
Mm-hmm.
Yeah, for me, it's really important for me that I am working kind of in depth in a couple of countries at least. And so as part of my kind of annual work programming, I make sure that I am supporting countries. I spend time in specific countries. I think it really provides a wealth of information. I also think that you can do this job. There's a lot of different models. And so I think even within WHO, you know, you're always going to get the standard career path of, well, you should start here and go here and then move here and there. And I think the reality is that it's all based on personal experience. And so what Ula's experience is, what my experience is, what my boss's experience is going to be different. And so, and I think that you'll gain different skill sets in different ways. And so I think that I completely agree that having that base in countries is really important. How you get that can differ, and that the traditional, because I do think that this job, if you were to do it in the traditional way, is built for one career professional, and I think it's okay to say, listen, the divorce rates are high in our fields. The World Bank, I find them to be still somewhat archaic in terms of two career individuals trying to plot careers and balance children and what that means I think being clear-eyed about that is important, and how you enter into that very carefully in terms of what, how you protect that space and navigate that space it can be tricky. So anyway.
No, that's great. Thank you. I mean, related to the first point, there's parallels there in terms of, picking disease areas that you work in as a health economist. You maybe, as you say, you pick a couple of countries that there's economies of scale that, there's a learning curve, and it's the same with having a disease area. Ola working in immunization, having that solid basis in one area, I think is probably, it makes sense, I think. There's another question that I can see that you've responded to, Susan. I don't know if Ola would want to contribute as well, but just someone asking for tips on transitioning from working in academia, at a university, to working at WHO or UNICEF or World Bank or whichever international organization it is, making that transition, what are the differences in skills, where the entry positions might be, that sort of thing. Any insights on that, I think?
Yeah, so I did that. I've been at UNICEF 4 years, coming from London School. So I did do that. First of all, there are many people coming from academia that transfer to international organizations, to UNICEF and WHO. So it's very natural. Like, many people we recruit are from academia. So it's a natural kind of way. And it was much easier than I thought. I really find the work fairly similar. It's not really, I don't have to publish, and I don't have as much time to just focus, but the problems and the topics are very similar. So I would say it's work-wise, it's an easy, and I mean, the way to do it is, it's really just to look at job descriptions and apply, yeah.
Mm-hmm. Okay, thanks, Ola. So to sort of pivot slightly and pick up on a point that you made earlier in your presentation about PhDs, should every early career researcher on this webinar who doesn't yet have a PhD, plan to undertake a PhD? And if not, are there specific career pathways to consider where not having a PhD as a health economist is fine and there are no issues at all? The thoughts from the panelists on to do or not to do a PhD would be good. Who's brave enough to go first?
I mean, I think someone has said it already. I think most people have said it already. Ola mentioned it and so on. You don't have to do a PhD. I think the only career that I am aware of where a PhD is a requirement to get to the top of that career is academia. Right, but if you're outside of academia, then it's not a requirement. And I think that in my experience, people really need to reflect and think about whether they want to do a PhD, because it's not a one-year course. It's minimum of 3 years. It's got its ups and downs. There's going to be moments where you're going to be frustrated. You will face challenges along the way. It's usually at a point in your career where you're thinking beyond just work. You're probably thinking about starting a family, or you're already starting a family, and so on. So you have very many competing demands at that point. And so you really need to reflect about whether you need a PhD, whether you want a PhD, whether your career track requires you to get a PhD. But it's not a requirement outside of academia.
Yeah, I just totally agree with what Edwin says there. Like in UNICEF, I would totally have got this job without a PhD. They really don't care. My colleagues don't even know I have one. They couldn't care less, right? It really doesn't matter. I mean, I know at WHO they write doctor in front of everybody. Everybody needs to be a doctor, but at UNICEF, no, it really doesn't matter. And yes, I mean, I want to say the PhD I did, honestly, it almost killed me. It's true what Edwin says. It's much harder than you think. Don't take it lightly, the work that this entails. It's really not something you just do. And exactly as you say, it often comes at a time of your life where you have so many priorities. So just don't underestimate the work that's required to actually complete it. It's hard.
I think I would working in more the HTA and economic evaluation world, I would agree that a PhD is not a requirement to do the type, like it isn't a requirement for, I don't think, any role within ICE. But that being said, that doesn't mean that there aren't quite a few people with PhDs around, because a lot of the work that we do is really technical. So you do see that there are quite a few people with PhDs. Some of them are health economics, some of them are completely different fields. So we've kind of ventured into, the HTA world. And it is because I think people who end up doing PhDs really like doing highly technical work. So that being said, and I do agree with it is, something to not take lightly. At the same time, I really enjoy doing a PhD, and I really enjoy kind of the challenges of trying to, try and do something new and develop something, where there wasn't really anything. So I really enjoyed that, that opportunity. It does, give you a lot of time to really explore something really in depth in a way that you don't ever get a chance anymore in the rest of your career, probably. Even as a postdoc, you spend so much more time also on, thinking about grant proposals and a million other things. A PhD is a nice opportunity to really get stuck in something for a good chunk of time. At least I did it full time, so not.
Yeah, that's what I want to add. Sorry, I want to say, if you can do it full time, if you get a scholarship, of course, it's fine. I mean, I did it while I worked full time. This is the issue. So that's what I mean. If you have 3 years and fully funded, it's of course fine. It's just so many people think they can do it while they work. And this is what I did, and I can't recommend it.
No, fair enough. I can see that itself might be a huge challenge, yeah. But at the same time, it's not a requirement in the field that I work in either.
Yeah, I think at least from the WHO World Bank kind of space, I do find that it's not a requirement. I mean, my boss, Joe Cutson, who doesn't have a PhD. And so it's not to say that you can't get there without it. It's a higher bar. There's no question that it makes it easier, but also just from a personal side, I have to say that coming out of my PhD, I felt trained. I would not be nearly the professional that I am without having done the PhD, having gone through the pain, the ups and the downs, but also, and I think that's what the best PhD will do is really train you in how to think, how to analyze, how to ask questions. And also it really expanded my professional network. Now that I'm at WHO, I go back through those networks in terms of who there are, when I'm starting a research project or I want to talk about something, I use those resources. And so, well, I totally agree it isn't necessary for me. It would be dishonest to say that it didn't have an enormous impact on who I feel as a professional.
Thanks, everybody. Some great points there. I can say that as someone who took 4 years to do a PhD, I feel slightly in awe of people like Susan who did the PhD and had kids at the same time. So massive respect to you for that. It took long enough for me without kids. Mark has asked a question which I was going to ask anyway, so it's always nice when these things align. How important is it for early career researchers to have a niche versus being a generalist? Does it matter more depending on where you want to end up, or is there some sort of more fundamental, it is important or it isn't important to have that niche? Any thoughts on that?
Yeah, I think a niche is important to have. I have it myself, and I just feel both where you sort of, for your networking, okay, the group becomes smaller, of course, if they are the people you really work with because they are in your little niche. Yeah, I find that really important, actually, because it's so important who you know. And then if you are going in all disease areas, because I think the medical profession, they have their niches. You know, if you are an infectious disease doctor, you only work in infectious disease. I actually think if we look at them, they're quite specialized. And so I would go for having a niche in health economics, yeah.
I think as someone who does a lot of, I feel like I do, I specialize in economic evaluation and HTA. So to that extent, I do have a niche, but within that, which is still kind of a broad field, within that, I've actually done a lot of different things. And I personally really enjoy that and think it has helped my career knowing a bit about. And this might have also inspired my all expertise is relative thing, because I have kind of done like a broad range of different subtopics. It can make you feel stretched at times because, it does require you that you will need to continuously learn about new disease areas, and that you might start from a place where you don't feel like you're, massively grasping a topic just yet. I really enjoy that. So I really enjoy kind of the continuous like learning and doing new things. So it really depends, I think, on what your preferences are. I also know lots of people who really enjoy the exact opposite of that, who really enjoy really getting stuck in one topic. So I would say that it depends on where you want to end up and what kind of career you aspire to, and also just your personal preferences. If you really enjoy new experiences, then you might gear towards doing lots of different things. But if that's not something you enjoy a lot, then definitely like go into one topic.
Thanks.
Yeah, I would agree with that.
Oh, sorry, go ahead, Edwin.
Yeah, I was going to say, I would agree with what Jacqueline just mentioned. I think it depends on your personality and what drives you and the kind of person that you are. And then it also depends on the context that you find yourself in. I think it's great to definitely, especially at the beginning, to really know one thing really well, to be an expert in an area. But then that should not stop you from broadening your interest and getting to learn beyond your niche or your main area of expertise. So it depends on the person. And then secondly, it depends on context, right? And here I'll give my personal example. I currently lead a research organization. I currently lead a diverse sort of health economics research group. It's impossible for me to just focus on one area because I lead a team that focuses on diverse things. So I have to develop an interest. I have to have my own interest, but also develop an interest in a broader range of things and support the people that are interested in those areas to grow.
I also just wanted to add, I think it depends on what stage of your early career you're at. So that maybe just coming out of a master's, for me already being a health economist, the people who are in this room, that's already a niche for me within economics, right? And so then how you narrow that down, can happen over time as well. I wouldn't necessarily feel as though, if you're just out of your master's or really young in that process, that it builds. But I think it's right that as you, all of a sudden, the choice sets narrows as you find something that you're interested in, or you might find something that you're not interested in, and then you change course. But not to feel stuck in one choice, that you can move within that, I think, as well.
Thanks, everybody. I think that has also sort of partially addressed a question about how hard it is to change fields or topics after doing your PhD, if you do a PhD, of course. There were some great questions, but I'm very coming on the chat, but I'm conscious of time. There was one question in particular I wanted to ask that I think is a really important one, which maybe we can end on. There are probably going to be some early career researchers in the audience who've recently experienced failure in some way in their careers for the first time. Whether it's your first paper rejection, which always feels like someone who's just ripped out your heart essentially, or your first grant rejection, probably a similar feeling. Is there any advice you have, as you're a little further in your careers about dealing with failure as an early career researcher? Any examples from your own careers that you could share related to this?
I'm happy to go first. I think it's a really good question. I think, and I almost put it in my slides, but I took it off just to focus on some other stuff. But failure is fine. You learn the most from when you mess up. I remember very vividly an interview I had to do for a project that was actually for WHO, was contributing to a background paper on the priority medicines report. I think it was years ago, and I had to interview someone, and it went horrible. It was bad. I still get embarrassed when I think about it, but it taught me a lot, right? Because it taught me exactly what not to do. So I think I learned from that experience a lot. So don't, failure is fine. Just don't be a Trump. Don't be it must be about everything else other than, myself and my own actions. Recognize the possibility that maybe, you didn't do something perfectly, rather than, blaming it on everything else. I think you learn the most from, things going wrong when you actually are able to reflect on the fact that maybe you didn't do a perfect job, and then identify why that was, and learn from that.
Thanks, Jackie.
Yeah, definitely. I mean, yeah, you always learn from the failures. You think back on them, and then they're the ones you learn most about. And I think you mentioned about the paper rejection. I mean, the thing is, the paper always improves when you take on board what they say. It doesn't feel like that in the moment, but afterwards, oh yeah, it did improve. Yeah.
Yeah, I think this is where the ability to also change course. I mean, I think about, starting my PhD at Berkeley and realizing, no, this wasn't the right fit. It just wasn't right for me. And then I ended up in the right place. But at the time when I left, it was really just, it destroyed me in some respects, because if you're somebody that's plotted a course and all of a sudden that course gets changed or something happens, I think realizing that, oh, it's okay, that sometimes, there are multiple different roads, but there's not necessarily a right road. And so I think having that adaptability is really, is just a life skill in general, because things are going to come up, whether it's professionally or personally.
Great. Okay. Thank you. Some great advice there, I think. Very conscious of time, and I know we've all spent far too much time on Zoom anyway at the moment, so I don't really want to go a minute over past. So I'm going to wrap up now. Thank you, first and foremost, to four speakers, Susan, Jacqueline, Ola, and Edwin, for your presentations, for your insights, tons of helpful advice, and I hope some of it is useful for everybody on this webinar. Before I finish, Daniel, is there anything from an iHEA perspective we need to say before wrapping up?
No, just thank you to all the speakers, and just a reminder that this webinar has been recorded and it will be uploaded onto our iHEA YouTube channel. So you guys are welcome to rewatch it many times and re-listen to all the great advice that was given, as well as the slides will also be uploaded onto the iHEA website in the coming days. So definitely pay attention to that and look for that. And again, subscribe to the YouTube channel to see other webinars that iHEA and the early career researchers have put on throughout the year, and there will be more throughout 2021. So I wish everybody the best. And thank you, James, for your help in planning this. And again, thank you to all our speakers and everyone who's attended. And I wish you all a great day.
Thank you very much, Daniel. And then a final thing for me, just keep your eyes open. There will be more webinars in the Early Career Researcher series advertised very soon. We work on that in the background. Thank you again to the speakers, and have a great morning, afternoon, evening, wherever you are. Bye, everybody.